So, welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal. And in this video, in this third video, I would like to talk about another integrative model. And the model is emotion focused therapy, or EFT for short. So, EFT is an integrative model which is based on a humanistic approach that really evolved into integrate concepts from cognitive neuroscience, cognitive therapy, from Gestalt therapy, and emotion theory. So it's a lot of things. EFT was developed by a group of researchers and clinicians composed by Robert Elliott, Leslie Greenberg, Laura Rice, Rhonda Goldman, and Susan Johnson, just to name a few. So EFT developed as an really empirical and research-based model. In the beginning, EFT suffered some changes. For instance, some of the work that Greenberg did with Johnson generated something that Susan Johnson calls nowadays emotionally focused therapy. It's an EFT approach that it's more based on attachment theory, and it's most suited to couples work. Not that you can't do with individual, but Susan Johnson is more couples therapist. So it has some differences. So don't get weird, or don't be a little weird if you heard about emotionally, or if you see emotionally focused therapy. So you have those two differences, but really is EFT just another kind of EFT. So the EFT therapists work with emotion. Primary, it's not that thoughts and behaviors don't matter, but for EFT therapists, the emotion is the central part of the patient and the relationship and the interaction. So it's really based on a client-centered approach, really based on empathy and validation. A lot of the original concepts of the humanistic approaches, for example, like Rogers and client-centered therapy. The EFT therapist goes where the emotion is, and what the therapist does is what EFT calls some markers, some emotional markers. So if the therapist noticed a specific marker, then he does a specific thing. For example, if the therapist needs some exploration, or he would like to, or if he noticed some bodily activation or body activation of the emotion, he would try to focus the patient on that feeling, on that emotion, really to activate it. So it's really an interesting thing to work. If you think about the CBT model, for instance, you have a really manualized approach and some phases of the model of the intervention. In EFT, you have the same thing, but the emotion is really what drives the therapist and his work. EFT also describes three kinds of emotions: primary emotions, secondary emotions, and instrumental emotions. So, the primary emotion is the first one that it's generated in the relationship, in the interaction, in the memory, and at the specific context. So, it's really the most powerful but also the most complex emotion that the patient has to deal with. So in that sense, the patient will try to protect himself, and then a secondary emotion would start to arise. For instance, if someone has had a loss, it could be a work position or a grieving of some kind, and the person will naturally feel sad. But if the sadness is too much to bear, a person might develop some anger towards something. It's I'm angry because I'm too sad. It's really sometimes it's difficult to understand it, but in most cases, people develop secondary emotions to deal with the primary emotion if they are not really conscious about the what they are feeling, or if they have difficulties in expressing those feelings in a healthy way. However, people can utilize emotions in certain contexts. For instance, we know that some types of patients try to manipulate the therapeutic process. So, in one way of manipulation, is really to show a specific emotion to gain a specific reward. If you think about it, children do that all the time. They start to cry, to scream, to make some tenders, and when the father or the mother or the parents give give the child what she asks for or what she demands for, it's like nothing happened. So the child utilizes a specific emotion to try to achieve what she wants from her parents, and it's what we called instrumental emotions. So, as I said before, one of the ways that EFT therapists work is to follow the emotion and to follow specific markers. In that sense, EFT therapists can have a lot of techniques and a lot of approaches depending of those markers. EFT therapists can utilize empathic questioning, empathic validation, empathic exploration. So there are a lot of empathy techniques that were developed by EFT therapists. Some of them there are also common in humanistic approaches and the client-centered therapy of Carl Rogers. Other tasks might be experiential work, such as the empty chair work or the two chairs work, or grounding, or focusing. Those tasks are from are also from Gestalt therapy, and they are utilized in specific conditions. For example, if an EFT therapist starts to notice a conflict between parts of the patient, he might utilize the two chairs work to try to resolve, to try to negotiate that conflict. For instance, if someone expresses unfinished business with a specific parent or a boyfriend or a husband or something, the EFT therapist might propose to the patient an empty chair work. So it's something like that. EFT is a really research model, for instance, for depression, for anxiety. As I said before, EFT can be utilized in individual therapy, but also in couples therapy. And I'm not sure, but I think that some EFT approaches might be utilized in family, also in family therapy. EFT is also validated to complex trauma. You have, for example, the work of Sandra Pavio, and also other things like eating disorders. Well, EFT is well researched and really real research based model that is evolving, and its work is in continuation. In Portugal, we have a group in Ismael, in the city of Porto, it's really dedicated to emotion focused therapy. They recently started a society of an association of emotion focused therapy, which is dedicated to the training of EFT therapists. So Portugal is really open to EFT uh, and its results, and it truly is an interesting and really experiential way of working. As a recommendation, I would leave you with this book. This is the Portuguese version. However, you can have this book in English also. This version was translated in Portuguese by these groups, I think. No, for by a different society, different therapy society, but it's the translation of a book called Emotion Focused Therapy, written by Leslie Greenberg. It's from APA, if I think, the American Psychological Association has a book on emotion focused therapy, in a series of books that they have from different therapy models. EFT has a lot of books. This is just one of them. It's a really nice book. It's kind of special to me because this is the first book that I bought on EFT, on emotion focused therapy. It's a really nice book that has all the basis and all the explanation about EFT. It's a good book to start with. As I said, this book is in Portuguese, but also you can find it in English. I think it's from the American Psychological Association. I'm almost certain of it. So that's my suggestion to you. I would like to end this video by saying that the next model that I will be talking about and I will be presenting about, it's from Arnold Lazarus, and it's called the multi-model therapy model. Please excuse the redundancy. So I would like to thank you for your time. If you like this video and if you like this kind of content, please share and subscribe. I hope you stay well, stay safe, be safe. Thank you for your time, and I'll see you in another opportunity.